This time I was working with medical doctors in Microsoft Research. We were really interested about predicting different epidemics, like cholera. We knew that cholera is a waterborne disease, so it's not surprising that this is caused after storms. Our system started looking for additional correlations in order to find those surprises that we were lacking. And what the system found out is that if you have 2 years before that a drought, the probability of the pattern storm and cholera is much higher. It was based at that time only on 6 examples from Angola. If you're building a statistical model, only 6 examples, this is not very reliable. But what if I told you that in Bangladesh, since 1960, there were 19 significant cases of cholera. In 84% of them, we had this exact pattern: drought, storm, then cholera. But why does it happen in Angola and Bangladesh and doesn't happen in New York? What is in common between those 2 places? In order to understand that, we started adding human knowledge to the system, things like Wikipedia, linked data, other data sets from the government, and started to look what was in common. It can be the area, the ethnic groups, so many factors. And what we automatically found out is that only 2 factors mattered in order for this pattern to happen. The country has to have low GDP, it has to be poor, and the next one is that they have to have low percentage of water. For me, this was surprising, as cholera is a waterborne disease. You would expect it that if you have a lot of water, then you're going to have cholera. But it turns out that cholera can be treated very easily. If you get clean water in time, mortality rates drop really fast. So countries that didn't have enough clean water couldn't stop the epidemic fast enough. In 2011, our system started learning about an outbreak of cholera in Cuba. This would be the first one in 130 years, so at that time I didn't think that this alert actually meant anything. Almost a year later, our system started learning with much higher probability that the cholera is going to happen because it saw that now it has storms. And a few months later, the first cholera outbreak in Cuba in 130 years occurs. Cholera is a disease that 100,000 people die from each year and can be very easily treated. If we knew in time when the cholera is going to happen, we could have sent clean water in time, and mortality rates would have dropped from 50% to less than 1%.